Welcome to Transformations. My guest today is Dr. Anthony Feinstein. He is professor of psychiatry at the University of Toronto and a neuropsychiatrist. His research and clinical work focuses on people with multiple sclerosis, traumatic brain injury, and conversation disorder. Dr. Feinstein has undertaken a number of studies investigating how frontline journalists are affected by their work covering war and man-made and natural disasters. Our interview today focuses on the content in two of his books, Moral Courage, 19 Profiles of Investigative Journalists, and Mind, Mood, and Memory, the Neurobehavioral Consequences of Multiple Sclerosis, as the content and subject matter relates to the mind, the brain, and trauma. I hope you'll find our conversation as interesting as I have. Welcome to the Transformations Podcast. Here, guests and I will share our transformative experiences and will explore how to find excellence in life. Anthony Feinstein, thank you very much for joining us today on Transformations.
Thank you for your interest. Very happy to be here.
Wonderful. Two of your books caught my attention and my imagination, Moral Courage, 19 Profiles of Investigative Journalists, and the other is Mind, Mood, and Memory, the Neurobehavioral Consequences of Multiple Sclerosis. I see a connection between those two right away, like it's almost one subject. There's different parts of different spokes on the wheel of the same subjects. Do you find that you moved in those areas or focused on those areas because of a common interest in the brain and the mind and so on?
Indirectly, my day job really is I run an MS research lab looking at behavioral difficulties in people with MS, cognitive problems, depression, anxiety, abnormal emotional responses. My interest in war journalism came about because a patient was referred to my clinical service who the initial thought was she had a neurological diagnosis. Turned out she didn't have one. It turned out to be a very severe stress reaction. And she was a frontline journalist. And this is going back a long time to 1999. And I was very intrigued by her presentation. And she did well with therapy. And through an interesting patient, I became interested in her profession, which was frontline journalism. So the link is indirect. She was referred to my clinical service, thought it was a neurological problem. It wasn't, turned out to be a stress reaction. And because of that, I started the second avenue of inquiry, which is looking at journalists who do conflict work. And that's been an enduring interest of mine for at least 2 decades now.
Is that because you, and you don't have to answer if it's private, because you have MS or people in your family, or just an interest in
No,
the
I don't.
No,
I don't. I thankfully don't have MS, but I find the disease really interesting. I did my PhD in MS. I trained in England, and the hospital that I was at was a noted MS research center. And I was very fortunate to have a mentor at that hospital. And I did my PhD soon after the very first MRI machine came into clinical practice. And it was really a transformative moment in medicine. It really was. It kind of opened up the brain in a way that was unimaginable. And for people doing MS work, it really was a very exciting time. And I was fortunate enough to be there as a young student, taking it all in. And that's where I became interested in MS.
Very interesting. My late parents both had, well, my late mother was a neuropsychologist, and my late father was a family practitioner, a GP, we call general practitioner, for 20 some years, and then became a radiologist because he got so interested in the MRIs, the CAT scans, the imaging, and so forth. And
it's easy to understand that.
Yeah, it's kind of like, ooh, new technology. We can look inside the body in ways that we could never see before.
Exactly. Technology actually drove many of the ideas. So we're talking now, I did my PhD from 1989 to 1992. The first MRI in England was the mid to late 80s. And so you suddenly had this fantastic new investigative tool that showed you the brain.
Right.
It was remarkable.
Yeah. Slices of the brain, that you hadn't seen, that weren't able to see without being invasive in any way.
That's correct.
I would think that the frontline journalists, their PTSD or the symptoms will be very much like the cognitive changes of MS patients, because you're having anxiety, you could have depression, irrational thinking, slow thought processes.
I mean, there's going to be a similarity. I mean, depression is depression, whether it affects someone with MS or whether they're a journalist.
Mhm.
But I mean, you're talking about two very different groups of people and two very different brains and two very different disorders. But yes, depression is depression, anxiety is anxiety. Thankfully, you don't see a lot of psychosis in either group, so that's good.
Good.
But as I've shown very clearly in my research, rates of depression can be quite high in frontline journalists.
Mm.
They're certainly very high in people with MS.
Right. Yeah. Now, you were born and raised in South Africa,
I
and
was.
were you a physician there and then went into psychiatry later? Is that correct?
Yeah, so I was born in South Africa, did my medical school training. I grew up in South Africa that was under apartheid and had left in the mid-1980s.
Mm-hmm.
And did my psychiatry training in England, including my PhD and my master's degrees in England, and then got headhunted by the University of Toronto to go across to Canada.
Nice. I'm down here in Philadelphia, so
Oh, lovely.
Toronto's just north.
Mm-hmm.
But what spurred your interest to move from medicine to psychiatry? Was there an event in your life, like having to fight in war? I mean, I think in South Africa you have to join the military for a period of time.
Well, if under apartheid, if you
Right.
if you were a white person, you were conscripted,
Right.
and I was an unwilling conscript. But if you said no, you go to jail for many years. It was a little bit like Vietnam in your country in the 60s and the 70s. I was conscripted. I didn't want to go to the army. I didn't agree with it. I had a very strong opposition to apartheid. So I went in under sufferance, but I did it. And while I was there as a physician, I was completed my basic training and then sent to the Department of Psychiatry to do myself. And that was really interesting. And putting aside all the wrongs of apartheid, just the clinical presentations were really quite fascinating, and that's where I would say I fell in love with psychiatry. It really was. It was just so interesting. Military psychiatry is obviously different from general psychiatry, but once again, the presentations were fascinating. I think that's when my career really started in psychiatry, was in the military.
Yeah, very interesting.
Mm.
Very interesting. And that led kind of your writing and your research. It just took you in a new direction, a transformative experience of, from being exposed to that and that under that situation that's otherwise not
It's
wanted.
true. It's true, because you see trauma up close. I was sent to the war in northern Namibia, southern Angola, so I saw trauma close up, firsthand, and the presentations were so dramatic that you don't forget it. And so I've had an enduring interest in trauma, psychological trauma, ever since then.
Mm. One of the things that, well, the main focus of your book on the frontline journalists is moral courage, and you talk about moral injury. So
Mm-hmm.
I would like you to first, if you could define your use of the word moral injury, because that's kind of the outcome of not having moral courage, I suppose. And then I'd like to talk a little about what is moral courage.
Yeah. So, I interviewed 19 remarkable journalists, and I was trying to understand what motivated them to do their work, which puts them in considerable physical danger. And I think there's a common thread that links them all. I write about moral courage, and I see moral courage, these individuals, as the antidote, as it were, to moral injury. And there are a couple definitions of moral injury, but the one that I like using comes from Syracuse University, and it refers to a condition that can arise in response to witnessing or perpetrating or failing to prevent acts that transgress your moral compass. So it comes about from things that you might do or other people do, acts of commission, or things that you might not do, acts of omission. I should have said something, I should have done something, but I kept quiet. And those behaviors come with uncomfortable emotions, such as guilt and shame. They're the primary emotions linked to moral injury. Our research also shows that anger is very prominent in journalists who have moral injury, and there can be a sense of disgust. And so these are very uncomfortable emotions to carry around with you. And for some people, they're intolerable. And the journalists that I interviewed for my book, to a man and woman, felt that they couldn't keep quiet in the face of what they saw as egregious behavior in their countries. Corrupt rulers, crime, despotic, authoritarian rulers, etc. They could not keep quiet. If they kept quiet, they had a sense of shame and a sense of guilt because it becomes an act of omission. And so in response to that, they become very courageous. They speak up and say, this is wrong, this is not right, this is undemocratic, etc. And then, of course, these intolerant governments come after them very hard, very, very hard.
Yeah. I mean, we see in China, journalists just disappearing, Russia being killed.
Exactly.
It's here in the United States, we're having big problems with moral courage. I mean, the Republican Party has seemed to have lost their moral courage to report on factual news and stand up against a potential authoritarian president again. And then we have the courage of some people like Liz Cheney and Adam Kinzinger standing up for what's right, and having to leave the party to do so.
Yeah, and I think the journalists who I spoke to, live in countries where there is very little press freedom. Russia,
right.
Belarus, places like that, Syria, Afghanistan, and those journalists, some of them say to me, you need to be careful in your democratic countries because this, the leaders in the United States, the places who look to these authoritarian rulers as a role model. They look at their playbook about, how do you control the press? How do you control the message? How do you break the media and make sure that's in your back pocket so that you can get your message out there? And so the kinds of techniques that authoritarian rulers use in places like Turkey, Hungary, Russia, become very attractive to leaders in the West who have the same kind of authoritarian bent. Which means that we can't be complacent in our democracies. We have to be very careful because these influences seep in, and they've already started. It's already started to happen, of course.
What do you think it is about? I mean, if we talk about our country is so big, North America, United States, say, is so big compared to, like, one of our states is one whole country in Europe, size-wise, relatively speaking. So we've got 52 countries as one country, so to speak. So I would think, theoretically, that it would be very hard for an authoritarian leader to come in and kind of take over and apply their mind control to the entire population, or at least 50% of it, or enough of it. But it seems like it's happening. It seemed like it happened a bit. And I just think, why is it that people don't care about all of the atrocities that a former president has done and are thinking to reelect him, even though they know all of that? It's a form of cognitive dissonance of some kind. Like, how does that happen?
Yeah, it's a good question. It's not something that I've researched, but I mean, you can see parallels with some of the countries that I wrote about.
Right.
These rulers understand you've got to control the message. You've got to put out the message. You've got to control the media, and then they work with very powerful media organizations to reach lots and lots of people. And you can sway people, as you know, through putting out messages that are untruthful, that there can be a whole pack of lies. But if it comes from a large media organization that does it in a sophisticated way, lots of people end up believing it, and so then the truth becomes a very fragile commodity, and you can get a lot of power that way. So the playbooks that Vladimir Putin uses, and Orban in Hungary, and Erdogan in Turkey, because they've been so singularly effective in allowing these rulers to take control of the country in a very despotic way, becomes very attractive to leaders in the West who have the same kind of inclination. They see how it works. There's the proof. It's worked. So let's replicate that.
You wrote about a woman, a female Indian journalist, Naya Dixit, I guess.
Yes, yes.
And I think her first couple of assignments were about human trafficking and sexual exploitation. And, being in a society, as you wrote in your book, that is misogynistic and racist, just as a daily, course of of a daily way for women. But she
Mm.
stayed in. She stayed in, and she continued despite all of this kind of backlash and pressing against her and fight. And you made a comment that, oh no, she did. I think you quoted her where she said she continued doing it because of a firmly set moral compass. Yeah, please correct me. Did you write that about her, or she said that?
It was my interpretation of what she was
Okay.
doing, yeah. Because what's
Yeah.
interesting is about that the journalists do this because they feel that it's the right thing to do, but they don't come from an academic framework of moral injury or moral courage. Those are abstractions that some of them haven't even heard about. And so when I have a discussion with them and say, well, let me talk to you about moral injury, that's not something that they've heard about, but they do this because they feel that it's right. This is the right thing to do. This is the right and decent thing to do. And it comes from this sense of, what's morally correct and what's wrong. And, trafficking people is very clearly morally wrong. Abusing women is clearly very, is egregious behavior. And so they're affronted by that. But they don't necessarily use the word moral. They just say this is wrong. This is bad behavior. This is not the way a healthy society should operate. But that's clearly coming from a moral framework, which in her case is extremely strong. And she sticks with this message despite tremendous online harassment, vicious online harassment of the nastiest kind. With a deeply hateful sexual content because she's a woman. People write her in a very very nasty way. But it goes beyond that. I mean, someone's broken into her apartment. A local police chief has let her know, we know where your mother lives.
Oh,
So
geez.
there's all these implicit threats, and that's so explicit threats.
Right.
And still, she's stuck with that message because she feels that this is so important. That if democratic society is going to endure, people have to make a stand. And that's another thing that you see across all these journalists, that they, in many cases, are the last remnants of democracy in countries that are losing all their democratic institutions. They're the last remnants of civil society. India is not as bad as Russia, of course, but in places like Russia, where there's no free press at all, journalists were the last remnants of civil society. And it's the same in many of the other countries that I write about, Belarus, Azerbaijan, those kind of places, because these authoritarian rulers control the courts, they control the judiciary, they strip away all aspects of good democratic civil society. They chase out the NGOs. They don't want people from outside in the country spreading out democratic message, etc. And so who's left? A handful of journalists who have this extraordinary courage to stand up and say this is wrong. You should not be doing this. Many in the media are cowed. They keep quiet because they know that if they speak out, the consequences for them can be terrible. Arrest, mock execution, you won't work again, financial ruin, sometimes even death. Write about the Russian journalist Anna Politkovskaya, who could not stand Putin. She loathed Putin, and she would write about it in very visceral prose. And people would say to her, "Tone down your rhetoric. This is dangerous." And she knew it was dangerous because her colleagues were getting killed. She would even, there's a memorable quote of her when she was at a funeral of a journalist saying, "I'm going to be next. They're going to come after me." But she still wouldn't stop. She still, kept on saying, Vladimir Putin is this terrible ruler. And so they killed her. She was killed on Putin's birthday. So there's the message. So this is very dangerous, hazardous work. But for these journalists, they feel compelled to do it because, as I say, for many of them, they're the last vestiges of civil society in the country. There's nothing else.
Right. So it's almost like they had to have some kind of spiritual or inner fortitude, more than moral courage, I think, to withstand everything, knowing that they could be killed, because what they're choosing is a de facto willingness to commit suicide, right?
I think that's I think that's a little strong. I know where you're going with this, and that was one of the criticisms perhaps of Anna Politkovskaya, that she didn't back off. But the other journalists, Yeah, they don't want to die, definitely not. And some of them have gone into exile for brief periods when the threat became too severe.
Yeah.
Um, Mr. Marquez, the Mexican photographer, when the threats from the corrupt politicians and the cartels was, really acute, and he saw colleagues of his getting killed, he left Mexico for a year because he realized this is far too dangerous for me. And then he came back afterwards.
Yeah.
Stefan Doksanovic in Serbia, who's been harassed relentlessly by the regime over there, also takes some brief time out of the country when he feels that the threat is too acute. So, these journalists don't want to die. No, they realize that this is a potential risk, but they don't want to die, and they'll do what they can to try and save themselves. And some of the journalists that are profiled in my book have subsequently been forced to leave their country.
Yeah.
For example, David Frenkel, the Russian photojournalist, who was really roughed up by the police, had his arm broken. Now cannot work in Russia. With the invasion of the Ukraine, he was part of many Russian journalists who had to leave the country. The cartoonist Kishore had to leave Bangladesh because it was just too hazardous for him to remain there. Mohammed Mosayyed had to leave Iran because he'd been arrested. The regime even arrested his girlfriend. So, coming back to your question, yes, death is one of the risks. Of course it is, but these journalists don't want to die. And when things get really, really that bad, some of them are forced into exile or temporary exile.
Right. Can you talk to us a little bit about, well, when you were defining what is moral courage, and you brought some definitions from the ancient Greeks, you mentioned Confucianism, also Taoism, Buddhism, talked about Plato's virtues. But you talked about the Venn diagram of Rushworth Kidder. And I think that would be an interesting thing, for people, because it's kind of easy with a visual to see. You've got three circles and they overlap. Or
It is, yes. I mean, his model is it's really very useful to try and understand what is moral courage. And he says, and I think it's really quite insightful, that you've got to have three essential ingredients. Number one, there's the background of danger, so you know that there's risk. Then number two, you've got to have your principles, and we saw these journalists have it. And then number three, you've got to have the endurance or the fortitude to act on your principles and do something and to keep doing it.
Right.
And so when you have those three variables intersecting with the Venn diagram, at the center of that, you have something called moral courage. And I think it's a really lovely way of trying to understand it. Then he goes on to say, if you've only got two of the three variables, you're not going to have moral courage. For example, if you have the principles and there's the danger, but you don't have the fortitude to act, then you've got timidity.
Right.
If you've got the danger and you've got the fortitude to act, but no principles, then you have physical courage, but there's no moral courage. So you can see how all three ingredients are key to having this thing called moral courage. And from my interpretation of things, trying to understand the motivation of these 19 journalists that I write about, and I'm conscious that motivation is a very complex thing. You can't boil it down to a single factor. But you can't be reductionistic because then you're simplifying something. Right. But a common thread that runs through all these journalists is that they have this moral courage as the antidote to moral injury. So when you speak out, when you do something, when you've got the fortitude to do something against the backdrop of all this danger, it keeps these emotions of guilt and shame at bay, personal guilt and shame at bay. They don't personally have these emotions that you're very uncomfortable to live with. But then the other side of the coin is it comes with, at times, a very, very difficult life.
Yeah.
Very powerful governments persecuting you.
I think of it almost like the courage to do it is like first responders in a burning building or in a war zone where they're running toward the danger and everyone else is running away from the danger. These journalists are stepping into the danger and kind of throwing, alcohol and wood on a fire by reporting it, so they're increasing the danger for themselves rather than running from it and staying quiet through fear and self-preservation or preservation for the family.
Yeah, there's overlap there, sure. That takes great courage to do that, yeah.
It takes tremendous courage. You had a quote in the opening of the book, and I'm going to read it so I don't misquote it. Life is mostly froth and bubble. Two things stand like stone: kindness in another's trouble and courage in your own. That's quite
Yeah,
profound.
it is. And that the book is dedicated to Diane Foley.
Mhm.
And I thought that that quote um, really matches this woman's remarkable life.
Yeah.
Her son was the journalist who was murdered by ISIS, and as a parent who lost a child, um, she's used the pain of that to start this incredible organization that helps families whose loved ones have been taken hostage. And so, out of something that's indescribably awful, she has created this remarkable organization to help people, and that takes it takes a lot of courage, a lot of emotional strength to do that. And so it was an honor to dedicate my book to a person like that. She does such wonderful work.
Yeah. Uh, It starts off the book, and then when you start reading the tales of these journalists, that's already set in the mind ahead of time. So it's almost like you're tick boxing all of the courage, the compassion, the gratitudes, the strengths of them. I thought it was very well chosen and very well placed um, in there. You make a comment that you said, as my book reveals, these journalists have not arrived at this rarefied place um, solely by chance. Moral courage, a component of free will, has led them there. Do you
Yes,
think that moral courage is tethered to free will? That courage and the courage with the motivation to go in and do something, is tethered with free will, or do you think
I
free will
do.
really exists in that
I
sense?
do
Okay.
because I do because I think you make conscious decisions about what I should do and what I shouldn't do. And they think, these journalists think these things through very carefully. They all
Yeah.
appreciate the grave risks, and so um, they're making informed decisions. They don't have to do this. They could go the way of many other journalists in the country and keep quiet and say nothing. Then their lives on one level will be a lot more comfortable, a lot less hazardous. They will be able to make a better living.
Yeah.
So yes, I think it's something that is very much a conscious decision, but it comes from a complex interplay of factors. As I say, they don't just arrive there by chance,
Right.
and it comes from many, many different influences in their lives.
You mentioned that the media also has a responsibility. And the media needs moral courage, of course, because to have the journalists running in and being part of this at the front line of wars and 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 riots and horrible things done in these countries and reporting on it or writing on it and have the news not cover it, for example. And you say there's both the decision of what the news media covers and what they choose not to cover. And I think of the journalists, or maybe it's the probably the networks, is looking out for their own longevity. Of we can't report on this too much. We have to report it this way, swing it that way, or just ignore it. How can do you think that the news media can do a better job when the reporters in that aren't making those decisions for themselves? They're working for a machine of some sort. Yeah.
I think that issue's been around a long time. I remember, when I first started to do this research, a number of journalists would say to me that they had risked life and limb to get a story, and then the news organization doesn't run it, and they feel bad about that. I don't know how qualified I am to comment on what news organizations put out or not. Um, what I do feel very strongly about is that if news organizations ask journalists to do this difficult work, then they have to take care of journalists.
Right.
And I think that's where there's a moral imperative. So you can't ask, these individuals to go and work in the world's most dangerous places and then, not have something for them should they become emotionally unwell because of this work.
Right.
And for me, when I started to do this research back in 1999, 2000, news organizations were not looking after journalists at all. Journalists had spent a long time in war zones. They'd spent years covering the civil wars in the Balkans. It's been very dangerous. They'd seen colleagues killed. They'd seen terrible things. And there weren't programs in big news organizations to help journalists who had become emotionally unwell. That, to put the stats in a clearer perspective, the majority of journalists will never develop post-traumatic stress disorder. They will never develop disabling depression. They will never develop significant anxiety. So it's not to say this is a traumatized profession. So I have to be very careful. I think that the statistics don't support that, thankfully. But the minority who do is a big minority. It's not an inconsequential minority. For example, if you look at the lifetime prevalence of post-traumatic stress disorder in a Canadian population, it's about 67%. 67% of Canadians over the course of their lifetime develop PTSD. When you look at frontline journalists, those ones who go back to war zones repeatedly, 15, 20-year careers in war zones, their rate of PTSD is going to be a lot higher than that, 3-4 times higher than that. But still, 80% are not going to develop PTSD.
Right.
But news organizations have to keep an eye on their emotional health, these journalists. You can't turn your back on it. And I'm pleased to report that, many big organizations now do it. There's been a sea change in attitudes. But when you step out of, some of the big American networks or Canadian news organizations, British ones, and you go to other places where we've collected lots of data from, like Kenya, Mexico, Iran, even Syria, Afghanistan, places like that, there's no discussion whatsoever about the emotional health of journalists. It's just an expectation that they cover, terrible stories, and somehow you're fine. And so the message that Western media have, which is, if you want to, do good journalism, have healthy journalists, hasn't filtered down into, many, many countries in this world, in which arguably the landscape is very, very dangerous, much more dangerous than in our countries, and they're not getting the kind of help that they need. And so the data that we've collected from places like Kenya and Mexico show high rates of trauma in journalists who've covered difficult stories, and it's going untreated. Yeah, and I think that's where there's a moral breakdown on the part of news organizations.
Right. We saw that with Vietnam, with the veterans coming back, not getting the treatment they needed with their PTSD and other things. We see it all the time. There's no funding. There's the powers that be aren't really caring enough for the people whose lives are putting at risk. There's journalists or military people. Yeah.
Mental health therapy is cheap therapy. Just seeing a therapist relative to high-tech medicine.
Yeah.
We're at the lower end of the scale in terms of costs, and the benefits are enormous. I'll give an example. At the height of the pandemic, a group at Oxford University that studies journalism approached my group and said, could you do a study looking at the way journalists are being affected by the pandemic? And so we teamed up with them, and we did a study. This was a study done in real time. And so we had a look at those news organizations that had made therapy freely available to journalists, and we're encouraging journalists to use therapy. And then we looked at organizations who didn't have that in place. And we could run a very clear comparison between the two groups. And the journalists who had access to therapy and were using it were significantly less anxious and less depressed and had less trauma symptoms than the journalists who were not using the service or the service was unavailable. And so there you have data in real time. There's a pandemic playing out, and here it is, a little bit of therapy. This is not long, complex, detailed therapy. It's sometimes just a few sessions can make the world of difference to how a person is feeling. And I like that study because there's nothing retrospective. We did it as a pandemic was unfolding. We said, this is what's going on. This is how people are benefiting from organizations that had something in place to help journalists cover very difficult stories.
I'd like to move a little bit into MS, the other area of focus, because then I want to talk about the therapies for both the journalists and the MS patients, the therapeutic intervention potentials. So in MS, I've had some family members with MS. Two of them had I think they had the demyelination in the brain and problems with seeing. Another one, their demyelination was in their thoracic area of their spine. So there was problems with numbness, tingling, you know, different physiological things, but not in the vision. But there was definitely cognitive impairment in the thinking, the processing of information. How does that demyelinization, well, you know, the way I describe it is kind of like the rubber coating on your electric cord. Your plug is, you know, run thin, so the signal gets shorted out. Would that be a good description of kind of a layman's description for people to understand of what's going on with that?
Yeah. So the myelin is the coating of the nerve, and it becomes damaged, and so then the conduction along the nerve becomes faulty, and that's how symptoms arise. What's interesting in my area, which is looking at like cognition and mood, etc., clearly demyelination is important, but it's often atrophy that is a more significant brain change. So when parts of the brain shrink, become smaller,
Yes.
that's when you often get more significant cognitive problems. So, yes, demyelination is extremely important. It's a key feature of the disease, and that by itself can cause symptoms. But the atrophy, when the key parts of the brain start shrinking, that some of these symptoms can be quite profound.
Is there a way with our technology to I don't want to say hydrate, but regrow that brain back to its normal size, or reinstall it back to where it was after that atrophy?
I mean, well, there are efforts to boost remyelination, so to try and repair myelin, and that there's a lot of research going into that. The atrophy is much harder to reverse because that's often irreversible, destructive brain damage. And so by the time it gets to, you've lost brain volume, it becomes much harder to treat.
Yeah. What about the new studies? I guess they're not so new now, but more recent studies in neuroplasticity and forming new neural pathways to get around maybe the damaged brain parts. Are there strong technologies and methodologies there today working in that area?
Well, I'll speak to my area, which is one that I'm most comfortable with, is that as part of our work looking at cognition and mood, we do both structural MRI, looking at the anatomy, but also functional MRI, looking at the neural circuits that underpin your emotions and your cognitive abilities like memory, etc. And you see some very striking examples of brain plasticity, of the damaged brain trying to work harder to compensate for the problem. And you can map that very nicely with functional brain imaging. But you also realize that for many people, there's a ceiling to their plasticity. So the brain works harder. It tries to reroute some signals, which is obviously not an efficient way to do it, but trying to compensate for what's going on. And then it reaches a ceiling in which beyond that, you can't compensate any further. Plasticity has ended. And you will reach that. You'll see that in individuals with more advanced multiple sclerosis, when the brain is more diseased, when there's more atrophy, or irreversible brain changes, you start seeing less plasticity within the brain. But this is something that's been a bit of a revelation to me. We've completed a very large study recently looking at cognitive dysfunction in people with advanced multiple sclerosis. So they have the progressive form of the disease, not the relapsing remitting form, but the progressive form. And they all had cognitive impairment. They all had impaired processing speed. That's the only way you could get into the study. So we looked at a group of individuals with impaired processing speed. And we did the study in multiple countries: in Canada, United States, United Kingdom, Italy, Belgium, and Denmark. So a very large international study, a big sample, over 300 people, advanced multiple sclerosis. And we put them into a regime in which we got them to become more active through exercise and cognitive rehabilitation. And we showed that in this group of individuals who were cognitively impaired to begin with, about 60% of the group at 12 weeks of this intervention, 60% showed what we think is some clinically significant cognitive improvement. And that's a lovely result, because this is a group that is unwell, physically quite disabled, cognitively impaired, clearly got degenerative aspects to the MS, and yet with a 12 weeks of intervention, which we they're more active, they're doing more things, they're physically more active, they're intellectually more active, they're socially more interactive. You see their processing speed start improving, start getting better.
Oh, that's amazing. That's actually a very large percentage when we look at other studies.
Yeah,
So
the question,
1%,
what happens after that? So you
3%.
have them in the study for 12 weeks of intense interventions, but you can't keep it going indefinitely. At that point, you say, okay, now it's up to your own devices to try and put into your life what you've learned from your time with us in the lab. We went back to that group 6 months after they ended their interventions, and we showed that almost 50% of that group still showed benefits from the intervention 6 months after they had stopped the intervention. So clearly, things linger, things remain. But the
Yeah.
great challenge for those individuals is to try and keep that kind of lifestyle going, to remain intellectually and socially and physically active, which is very, very difficult to do. If you think about our own lives, we're always making resolutions, come the new year, I want to be on a new diet, I want to lose weight, I want to do X. We always do this, and it's very hard to follow through with it. So
Yes.
imagine trying to follow through with it when you've got a really difficult disease like multiple sclerosis and you're disabled and you've got some cognitive problems. So that becomes the next challenge. But the first step was to show that this group can indeed improve. And that's encouraging.
Very encouraging. I think of maybe the need of an advocate for the group, an advocate for the MS patients who have gone through this cognitive rehabilitation, who would call them once a week or twice a month. Have you checked in on this? Or send them a text, like a coach, that's maybe it's automated even for a bit. Did you go out for a walk today? Did you talk to your aunt today?
Yeah.
Just as little reminders, because I assume that when they're dealing with these cognitive issues, especially with depression and anxiety, it's very hard to get motivated to get up to reach out to people.
Yeah.
Yeah.
No, for sure.
Yeah. And when you talk about cognitive rehabilitation, does that including like cognitive behavioral therapy or just talk therapy or just
cognitive behavior therapy is a treatment for depression.
Right.
CBT, cognitive behavior therapy, developed by Aaron Beck in your hometown, Philadelphia.
Shout out.
Yeah, but and that's an effective way of helping people who are depressed and anxious. We know that there's some really good CBT data now. And in fact, the American Academy of Neurology, when they put out a position paper on how best to treat depression in people with MS, they showed from reviewing the literature that the treatment of choice is going to be cognitive behavior therapy. And now there's some really good CBT programs that are available via computer, and so they can be done remotely. So that's for depression. When you talk about cognitive dysfunction, you're looking at things like processing speed that are impaired, memory, executive functioning. CBT is not for that. Now you talk about cognitive rehabilitation. Cognitive rehabilitation is different from cognitive behavior therapy. And cognitive rehabilitation is you target that specific cognitive deficit, whether it's processing speed or memory, to see whether you can improve it. And now there's some, really clever computer programs that are being brought into rehabilitation centers to try and improve cognitive deficits, not just to work around them, but to improve them. Can we improve processing speed? We showed in our big study that wrapped up a couple of months back that indeed you can improve processing speed using one of these programs that gets people intellectually active, combined with exercise, some social activity, etc. You get cognitive improvement, even in advanced multiple sclerosis.
And I'm assuming this activity is more than just crossword puzzles and building tinker toys as it was in the past, keep the mind active, learn a new painting or art therapy.
Yeah, keeping the mind active is really very important. But the program that we use is one that builds in a sequential way on their cognitive ability. So it's tailored to the individual. Where are you now with your cognition? Because people are going to be at multiple different levels. Some people mildly impaired, some people are more impaired. So you start off at their level, and then you have a program that pushes them step by step to the next level. And once they get to that level, then you move on to the next level. But you can't go to the next level unless you move on. So it takes them sequentially through a tailored intervention that builds on their gains by trying to give further gains. It comes back to this whole notion of plasticity. How plastic is your brain? How much can it adapt to what the program is asking you to do? And so in a sequential way, you take people through it, each step up being a further improvement in your cognitive abilities until you reach some kind of threshold or ceiling.
Wow, that's exciting news. I mean, knowing that we can measure those things.
Mhm.
What is your threshold? So how much can we improve or not improve rather than guessing? Um,
Exactly, and that's
yeah.
that you get that from your cognitive results combined with brain imaging.
Mhm.
So you're starting to get markers of telling us what's possible.
Yeah. You had written about the use of cannabis for MS. I know
Mm,
that it's been legalized here in the United States, and it seems to be a boon for people suffering with all kinds of things. The medical marijuana,
yes,
at least the CBD mixed with the THC and at certain ratios, and there's different strains and all kinds of terpenes and all kinds of things that I'm only repeating words that I hear from family members that
right.
use it and feel a market improvement from it. How does that kind of an intervention is helping with MS? Is it for the symptomatic relief, or is it also help with some kind of
Well,
cognitive?
yeah, no, I think like any drug, you have to weigh up benefits and side effects. And from where I sit as someone who does a lot of cognitive work, there's a real concern about cannabis THC.
Right.
So we've published multiple papers in people with multiple sclerosis showing that cannabis THC is associated with further cognitive decline.
Mm,
And it's a worry because as the drug has become legalized, lots and lots of people are using it. And so that's a concern. Now, the good aspect to this research is that if you stop the cannabis, your cognition can improve. And we've shown that
mm,
very clearly. So if you stop the drug and you stay off it for 28 days, your cognition rebounds to where it was.
mm.
Well, it rebounds, not necessarily where it was, but certainly it can improve. So it's reversible. That's the good news.
Right.
But the worry is that it does add to the cognitive burden in people with MS. Now, I don't think you see that with the CBD because
Right.
CBD is not psychoactive, but the THC is psychoactive, and that's a problem. And so
Right.
if you've already got a brain that's compromised through multiple sclerosis, if you've already got a brain that's struggling to function because of a neurological problem, and now you add a psychoactive component like cannabis to it, then potentially you can get a lot more cognitive problems. The plus side is, and there is a plus side because patients say to me, that the medication makes me feel better. And I absolutely accept that. You're telling me, of course I trust you, this it makes you feel better. And so then as a physician, you have to say to your patient, okay, well, let's try and weigh up the pros and the cons. Do the benefits outweigh the negative aspects to the drug? And that's going to be the same story with any medication that you take. Do the benefits outweigh the side effects?
Mhm.
And that's when you have, a very frank discussion with your patient saying, look, now I hear that you feel that the medication is giving you some relief for your pain, and that's fantastic. But it's also hitting your memory. Here's the data. It's also slowing down your processing speed. You've got a choice. What do you want to do?
Right.
And I have to tell you, the majority of people want to stay on the drug. I
Yeah.
think that's a really intriguing observation that despite sitting down with my patients and showing them, this is how the medication has changed your cognition. We even do functional brain imaging to show how the networks start changing in response to cannabis use and how you start seeing a loss of brain plasticity because of cannabis THC. Even when individuals see that, the majority say to me, thanks for giving me the information. I appreciate it. I can make an informed decision. I'm going to stay on the drug because I feel better because of it.
Right.
And so, it becomes a challenge in clinical practice because you've got a patient population that's not insubstantial saying, we want to take this drug. It's legal. There's no problem taking it. And then you've got data showing, hold on a second, it's worsening your cognition.
Mm.
So you've got to keep a very close eye on this.
Yeah. But I think, pain is a big thing that people need to overcome, and
Absolutely.
discomfort, and thinking about in the moment reducing pain, and this medicine is helping versus,
Yes,
okay, in 3 to 5 years, my cognition, but who knows if I can handle this pain between now and
I
then.
get it. I
Yeah.
get it.
Oh, I'm
Sure. And
sure
they
you
take
get
it.
it better than
And
me.
they take it. No, they do. They take it for spasticity,
Yeah.
which is very uncomfortable as well. Although it's not necessarily, very strong data supporting its use. But if the patient says to you, "Hey, doc, I feel better on this drug," who
Right.
is it for me to say, no, you don't? Of course I accept that. I accept, and I say, that's good. I'm really glad it's helping you. But like any drug, let's try and understand what are the potential side effects.
Mhm.
People say anti-inflammatory medication, it helps arthritis. Absolutely it does. But, it can also erode your stomach and give you a gastric ulcer. There's
Right.
always going to be pros and cons with medication. And as a good physician, you've got to be cognizant of what they are. And cannabis does come with some very significant side effects.
What about, have you studied or looked into the interventions of things like EMDR for PTSD, if you're familiar with that therapy,
Yeah.
you know, and like meditation for anxiety, depression, and maybe I know that you talk about a combined therapeutic approach in your book, and how that is very important. So I'm wondering, in addition to the therapies that you're using at your clinic or with your patients, how some of these other ones like EMDR, meditation, are also influencing.
Okay. So it's just keeping the focus on people with MS. I've spoken about the really good research data for cognitive behavior therapy. There's also emerging data suggesting that mindfulness-based therapy can be very effective as well for people with MS. And so, you know, there are some nice psychotherapies that help individuals with multiple sclerosis. EMDR is a therapy specifically for trauma, as you know, for PTSD. You're not going to see PTSD to any significant degree in people with MS, but you'll find it in frontline journalists. And I'm not an EMDR specialist, but I have, you know, colleagues who use the therapy, and they, you know, they get some nice results with journalists. And I do know some frontline journalists who had PTSD who've responded well to EMDR. To spell out what it is, it's eye movement desensitization and reprocessing. So there are therapists who use it, and I think they use it quite effectively. But it's just one tool in a larger toolkit, right? CBT can be helpful for PTSD. Prolonged exposure therapy can be helpful as well. So there are different strategies that you can use for treating PTSD.
Nice. I wonder if there's a strategy that would, or that you're looking into, that would allow people to change from the THC, predominantly THC cannabis, to more of a CBD and less THC by combining it with something else over a period to get a similar result.
Yes, I think that would be certainly one way to go, to try and get them off a medication that has known side effects with respect to your cognition, onto something that's going to give you the same benefits and less side effects. Absolutely, that's one of the ways to go. But you know, but patients want THC often more than they want CBD, because they're responding to the psychoactive component that makes it feel different.
And I guess that's what we're looking for, is a change in our quality of life, right? A change in our mental state, day to day.
I mean, you know, one of the findings we showed with, you know, with people who use cannabis, people with MS use cannabis, they would say to us, and we've got research data to show it, that they felt more comfortable in social situations when they used cannabis. Well, that's a huge plus for people. You know, if it means you're going to go out and leave your home and intermingle with people and have social interaction, that's a very pleasant activity. And if cannabis is helping you do that, then it's a very significant change. So that's one of the reasons we think why they want to stay on the medication as opposed to come off.
I'd like to just circle back to the frontline journalists for a moment, because I've been thinking about something as we're talking. I think about people who are enlisted in the military, and they choose to do second tours in a military campaign, like 2 tours in Iraq, 3 in Afghanistan, or what. They're choosing to put themselves in that situation again for whatever reason. So the traumas, it's laying on top of, it's just laying more and more trauma on top of itself. And these journalists who keep going out despite the threats, now there's going to be more life-threatening threats to the family, the trauma, the explosions, the dead babies, but they're still going out. Talk about courage, but you know, they're putting themselves on purpose. They're making that decision to go out and do this. That is really remarkable, I think.
It is. I mean, I think that the journalists who've had long careers covering war represent a profession that has the biggest exposure to trauma. So you think of, you know, soldiers, they have 1 tour of duty for the most part, and that's it. Sometimes 2. You read, you know, some veterans go back 3 or 4 times, but most people have 1 tour and that's it. But these journalists go back decade after decade, some of them, you know, and see a lot of conflict. And so there's an enormous cumulative load of exposure to trauma. This is one anecdote given to me by Christina Lamb, the British correspondent, who has seen a lot of combat. And she was in Afghanistan with a group of British Marines, and they came under attack by the Taliban. And she looked around and she realized that she had far more combat exposure than the young men who were there protecting her. For them, it was, their first maybe combat exposure, where
Right.
Christina Lamb had been around a lot of water and she's seen a lot of bad stuff, and so you're quite right. There's this cumulative exposure to very, very dangerous places. And that's why you'll find that the rates of PTSD in this group is significantly higher than it is in the general population, for example. It's completely understandable. If you're going to go back, this is your work environment. You're going to be working in the world's most dangerous places. You're going to be potentially vulnerable to PTSD. Perhaps the more remarkable finding is that the majority don't get it. And I keep on repeating that. We study trauma, but you're not studying a traumatized profession. You're studying as people within a profession who's developed PTSD. The majority don't.
Right, because they're not on that front line. Yeah.
Even if they're on the front line, the majority of those journalists won't get PTSD. But the minority who do is a high minority. Four times the general population rate, for example.
Right. Wow. I want to thank you for sharing all of this with us. It's quite fascinating. And I'd like to just mention that the book about the journalists and Frontline is called Moral Courage, 19 Profiles of Investigative Journalists. And the book with relation to multiple sclerosis is called Mind, Mood, and Memory, the neurobehavioral consequences of multiple sclerosis. And I'd like to thank you very much, Dr. Feinstein, for your time and insights. It's been quite interesting, and my brain kept bopping back and forth, but I hope that the viewers' brains will as well, because these topics of the mind and the brain are very interesting to me. I wish I was more educated in them to speak about them, form my questions better.
No, I very much enjoyed talking to you. It's the first time that I've ever had a discussion like this in which I moved between MS and my war-driven research, and I enjoyed it. So thank you for asking this question.